Hi, I'm Dr. Ankita. I'm one of the doctors here. What may I call you?
You can call me Vilma.
Vilma, may I confirm your age, please?
I'm 50.
And what is it that you do?
I am a sweeper.
Vilma, I believe you were here to see our consultant, but our consultant couldn't be here. Is it okay if I continue the discussion on his behalf?
Yeah, sure, that's fine.
Mm-hmm. So, Vilma, I have gone through your GP letter and I'm aware of your situation. Can you tell me, is it okay if I ask you a few questions?
Yeah, sure.
All right. So, could you describe in detail your complaints, please?
Doctor, I had a hysterectomy about 5 years ago for fibroids. And after that, everything was good. But 6 months back, I noticed that there was a lump coming from down below, and which has increased over a period of time. It is distressing because it's interfering with the way I walk, my work life also. So I just wanted to get rid
Mhm.
of it.
So sorry to hear that, Wilma. We will try our best to help you with this, all right?
Thank you.
Can you
Yes.
tell me if you have any bowel problems?
Well, I have been, having constipation for a while now. My GP has given me some stool softeners, but that has not really worked out.
All right, we'll look into that as well. Do you have any complaints with your waterworks?
Not really.
Any pain?
No,
Any vaginal discharge?
no discharge.
So can you tell me in detail about the surgery for fibroids that you had?
Well, it was a keyhole surgery 5 years ago, as I mentioned, and nothing went wrong with the surgery. In fact, it was a wonderful experience. I stayed for only about a couple of days, no pain at all. After the surgery, also no issues. Yeah,
All right, it's really nice to know that you had a good experience with us. Were your ovaries retained?
I'm not sure. But
And
the
what
neck
about the
of the
neck of the
womb
womb
was,
was removed?
yeah, neck of the womb was fully removed, I think.
All right, okay. So your smears prior to that, were you following up and were they normal?
Yes, they were. It was quite regular.
All right, okay. So are you well supported at home?
I am. I live with my husband.
And have you been pregnant before?
I have two normal deliveries before, but both my kids have moved out.
Okay, and don't mind me asking a few personal questions. Are you currently sexually active?
Yes, I am.
And is there a problem during sex?
Well, I haven't mentioned this to anybody else, but I do experience some dryness, and that causes pain at times.
Sorry to hear that. We do have options. We could offer you estrogen cream. Is that okay with you?
Yeah, sure, sounds good.
All right. Do you have any chronic cough?
No, I don't.
Any medical disease?
No,
Any surgeries other than the one you mentioned?
no,
Any allergies?
no.
You mentioned you are a sweeper. Does it involve lifting up heavy weights?
Yes, it does, in fact. Yeah.
Okay. Do you smoke?
No, I don't smoke.
What about alcohol?
No,
Any recreational drugs?
none at all.
Okay. And in the past few weeks, have you felt low or upset?
No, not particularly.
Hmm. And how this problem, is it affecting your quality of life?
As I mentioned, yeah, to some extent I feel because it affects my work also.
Hmm. Thank you, Wilma, for all that information. Do you have any specific concerns?
No, nothing in particular. Just I have heard from my friends that this can be cured with an operation to put it back up, and that will solve all my problems. So I was hoping to know more about that.
Surely, I will give you all the options that are available to you, and your wishes would be respected, Wilma. But is it okay if I examine you in the presence of the chaperone with the consent to confirm the GP's findings? I can
Yeah,
see then the
certainly,
GP
yes.
letter. Yes, I can see in the GP letter that your BMI, that is your weight for height ratio, is 35.
Mm.
So from your history and examination findings, it seems that you have a condition called rectocoele and vaginal wall prolapse. Have you heard of these?
No. Can you tell me?
Mhm. Yes, a rectocoele is basically a condition wherein the back wall of the vagina descends down along with the back passage, and a wall prolapse is where the upper portion of the vagina sags down sometimes. So this happens because of weakening of the tissues that normally support the vagina. Am I clear?
Oh, oh, but why did this happen?
That's a valid question, Vilma. Actually, it may be because of multiple reasons. One of them could be your menopausal status, could be the previous deliveries, previous surgery itself. It could be possible that the high weight for height ratio may have contributed to this, as well as your constipation and the fact that you have been lifting heavy weights at work. All right.
Hmm.
So yes, as far as the management is concerned, you would be reviewed by a team of specialist doctors that would include our consultant as well as the specialist. And I
I
know that
see.
you are keen on surgical options. Is that right?
Yeah,
Would you like to
yeah.
know
I
those?
want to know what types of operations can be there.
Yes, let me explain. So in this particular operation that we would offer you, it is called as posterior colporrhaphy, which involves putting
Okay.
the back wall of the vagina back in its place, and the vault, that is the upper portion of the vagina, may also be stitched to a certain ligament, which is a fibrous bend deep in the pelvis, so as to put it back higher up. All right?
Mm-hmm. Yes.
Yes, but I must also warn you, Vilma, that when you do have certain risk factors like high weight for height ratio, constipation, etc., if these are not addressed, then the chance that the surgery may fail and you may have a recurrence of this particular condition is high. Also, when the weight for height ratio is high, there may be certain complications associated with the surgery, like anesthesia risks, risks of bleeding, infection, formation of clots, etc., and your recovery may be delayed. All right. So
Oh.
generally, yes. So generally, in such a condition, we do recommend that you follow certain lifestyle measures. We could refer you to the dietitian and the physiotherapist for certain dietary modification as well as a routine exercise that you could follow. We would also refer you to a physiotherapist for the certain pelvic floor muscle exercises that you could do so as to build up strength of your pelvic muscles. All right.
Mm-hmm.
You mentioned that you lift heavy weights at work, so we could refer you to an occupational therapist as well. Okay.
Okay.
And as far as your constipation is concerned, that would need treatment. So we encourage you to drink plenty of fluids and have high fiber diet. Maybe we could add a few medicines for you or review your medications that you're currently taking. Is that all
Mm.
right?
Yes. Okay.
Okay, so also there is another thing that we could do while you are trying to lose weight. We could insert a certain device that we refer to as pessaries. Pessaries are devices that can lift up the vaginal wall back in its place, and they can be inserted in the vagina. So we could
Mm-hmm.
use this as a temporary measure while you are trying the other methods. Is that okay with
Okay.
you? Yes.
Yeah, sounds good. Yeah.
Do you have any other questions?
I had also read about this mesh. Can that be used?
All right. So yes, that's a good question. Currently, it is not recommended offering mesh procedure for such a repair, and that is because there may be certain complications that mesh may come out of the vagina. It is called a condition called as mesh erosion, and there may be problems for you. So currently, it is
Okay.
recommended only in research setting, and we could discuss the same with you. All right.
Mm. All right. Hmm.
So I know all this can be a bit stressful, so we do have counselors and support groups available, so you could seek help there as well.
Okay.
So I would give you some patient information leaflet. I'll write back to your GP and document this consultation and arrange for an appointment with my consultant. Is that
Okay.
okay with you?
Yes, thank you.
Thank you for your time.